Good morning. Thank you for joining us for today's Legislative Affairs Virtual Town Hall with Director for UC Benefits and, with the Director of Legislative Affairs, Josh Towsey, and the Director for the Bureau of Workforce Partnerships and Operations, Crystal Hauser. A few key points we'd like to open up with before we get started with today's format. Purposes of this call is to provide you with educational and training information to assist you in providing responses to your office's constituents regarding the UC program, and in this case specifically today, workforce development. If you have any questions, we ask that you use the chat window in Teams. Please include your name and the name of your legislator's office along with your questions, and they will be addressed as Crystal is able. In the interest of time, please use the chat function, and this presentation should take about approximately 30 minutes. And with that, just to give a quick note, because everybody is always asking, our LegWeb system currently has 28 pending in the queue, with the oldest inquiry being from yesterday at 11:15 a.m. So we're a little under 24 hours between when the LegWeb request is placed and when it has been taken care of. In addition, afterwards, we will be providing legislative staffers with the link to this recording following today's call. We'll also include a follow-up to any remaining issues that we did not have an opportunity to address this morning. For your awareness, the call is being recorded, so if you do not consent to being recorded, please hang up now. And with that, we'll get started with comments from Josh and then the presentation with Crystal.
Thanks, Kate. I think you covered everything. I was just going to give the LegWeb update, and thank you, Crystal, for joining us today and giving us this presentation. So I'll pass it off to you.
Good morning, and thank you all for having me on this call. Just going to share my screen. Hopefully you are able to see the presentation.
I can see it.
Thank you. Okay, so today I'm here to speak about a UI claimant re-engagement project that we recently completed here at Labor and Industry. Given the recent declines in workforce participation, the Pennsylvania Department of Labor and Industry recognized the need to re-engage unemployed Pennsylvanians into the workforce. The Labor and Industry led this UI claimant re-engagement project. It was a statewide initiative to re-engage more than 400,000 unemployment insurance claimants who received at least one unemployment payment in 2020, 2021, or 2022, and were inactive in the workforce as of third quarter 2023. Labor and Industry received this information from the Center of Workforce Information and Analysis. So the UI claimant re-engagement project included outreach activities to identify those individuals' barriers to returning to the workforce, their skills shortages, and possible areas of service delivery improvement across the service delivery system, which is PA CareerLink offices across the state. This presentation will uncover the findings and results of the UI claimant re-engagement project, as well as recommendations on what can be done to improve workforce participation for thousands of Pennsylvanians. So here you see just a sort of timeline and process of the project. We had an initial public survey. After the survey, there was outreach to individuals that wanted outreach. We were able to tweak the survey that went out to the 400,000 unemployment claimants. We did an additional round of regional outreach. We conducted focus groups, and that led to recommendations from this report. As I said, a public survey was sent first, and this initial survey was posted on PA CareerLink online. So customers had the ability to see the link online. Our staff at PA CareerLink offices across the state led their customers to this survey, And after reviewing these responses, we were able to tweak and target the questions that were going to be sent to the larger group. The public survey was used for an initial outreach to PA CareerLink prospective and already enrolled job seekers. Both the public survey and the UI claimant survey included a question asking if the respondent wanted to be contacted by PA CareerLink staff. This question had a required response. The public survey contact information for respondents who indicated that they would like to be contacted was forwarded to the assistant regional directors across the state, and it was divided up depending on the zip code for each respondent. ARDs and the regional teams made efforts to contact each of these respondents to share the information about PA CareerLink services and provide referral information as appropriate. So for the public survey, we had 694 respondents. Of the 694 respondents that requested contact, PA CareerLink staff was able to contact 440 of these individuals. And of these 440 individuals, 145 went on to become participants in one of the PA CareerLink programs. So for outreach, this was actually a very successful round of engagement. The UC claimant survey was used to gather data from the UI claimants on their perceived barriers, needs, and services that would assist them in re-entering the workforce. On February 5th, 2024, 410,000 UI claimants were sent an email using Constant Contact. Communication to UI claimants was drafted. The message included why they were being contacted, because they had filed for unemployment compensation during that 3-year period. And a reminder email was sent on February 23rd, 2024, 3 days before the close of the survey. The UI claimant survey had 16 questions, and it was sent to individuals with a Microsoft Forms survey link. The survey was designed to be anonymous unless claimants indicated they wanted to be contacted by PA CareerLink staff members, or if they were willing to participate in a focus group to learn more, so we could learn more about their experiences, barriers, and needs. In this case, respondents were given the opportunity to provide contact information. The survey sought to answer the questions on the screen. The survey closed on February 26, 2024, and a total of 5,262 responses were received. While all 5,262 responses were included in the demographic analysis, 514 responses were ineligible because they were retired or working, and they were excluded from further analysis. The survey did collect demographic information such as gender, race, ethnicity, age, and work experience. So gender information, there were more female respondents, just over by 54%, than male respondents, 44%, and less than 1% of the respondents identified as non-binary. For race, ethnicity, 74% reported identifying as white, 11% African American, 5% reported identifying as more than one race, 4% reported identifying as Hispanic, 1% reported identifying as Asian American, and American Indian and Hawaiian or other Pacific Islander were both below 1%. And the age demographic. As you can see, 24% were 65 or older, 23% were between 55 and 64, 20% were between the ages of 35 to 44, 18% were between the ages of 45 to 54, 13% were between the ages of 25 and 34, and 1% of the respondents were between the ages of 17 and 24. Only 1% of the respondents preferred not to answer. I thought this was interesting. So 86% of the respondents spent 11 or more years in the workforce. 11% spent 3 to 10 years in the workforce, and 3% reported 0 to 3 years in the workforce. One of the things I anticipated finding through this survey was that many of the individuals who were out of work during that 3-year period had turned to the gig economy. And per the survey, only 10% of the respondents reported working in the gig economy. And I can tell you that the survey did explain what the gig economy was. The survey posed the question, do you believe any of the following barriers were keeping you from working? And the following selection of barriers was offered. There was also an other prompt that individuals could identify any other barriers that they felt were keeping them from working. So now we're going to dig into the barriers, the needs to return to the workforce, and the services that these individuals identified as things they needed to return to the workforce. Health concerns was the most reported at 23%. Transportation was the second highest as 13%. Transportation was closely followed by childcare at 12%, age at 11%, training and background checks both at 10%. Caregiving was identified by 8% of the respondents, and special accommodations was selected by 2%. GED also by 2%, and recovery and addiction by 1% of the respondents. Gender appears to influence the barriers that respondents experienced. Female respondents were overrepresented by the barriers of caregiver, childcare, and special accommodations. Male respondents were more likely to report age, background check, and recovery and addiction as barriers. Background check, childcare, and transportation each had a follow-up question because they were identified by the team as consistently named as barriers by PA Career Link staff. The majority of respondents selected that their offense was the primary reason that a background check was their barrier for re-entering the workforce. That was followed by cost. Cost was followed by difficulty in completing the fingerprinting requirement. And support for completing or paying for background checks would be an appropriate supportive services for these individuals. The majority of respondents reported that cost is their primary barrier to accessing childcare, stating that childcare is not affordable. Respondents also reported that the availability of childcare is a barrier, either in lack of facilities or facilities do not have schedules that meet their needs. Only a few respondents stated that available childcare facilities do not meet the needs of their children. The cost of childcare is an issue that cannot be readily solved through the services provided by PA CareerLink. Raising this issue as a barrier that severely constrains individuals from entering the job market to policymakers may help shine a light on the need for solution building at that level so that parents may be able to re-enter the workforce. Not having personal transportation was the primary reason that transportation was a barrier for respondents. This was followed by the cost for gas or vehicle costs such as repairs and insurance, which was followed by scheduling, followed by respondents not having a driver's license, and lastly, reliability. Rural areas seem to be more burdened by a lack of public transportation infrastructure. It is unknown why some respondents reported not having a driver's license, but exploring this issue with clients could support how to serve these individuals and overcome that barrier. Survey respondents were asked to identify what they would need to return to the workforce. In combination, flexible workplace, flexible schedule, and remote work accounted for 85% of the survey respondents. Training to change career pathways was the most selected service required to return to the workplace. Addressing respondents' particular barriers was the closest next response, followed closely by job search assistance. This survey questions response has the greatest direct application for PA CareerLink staff, as these services are concrete supports that staff can provide to clients. The UI claimant survey included a question asking if the respondent wanted to be contacted by PA CareerLink staff. This question had a required response. The assistant regional directors and the regional teams made efforts to contact each of these respondents to share information about PA CareerLink services and provide referral information as appropriate. As you can see, out of the 5,262 respondents of the survey, 1,178 UI claimants requested contact by PA CareerLink staff. 718 of those that requested contact were actually contacted by PA CareerLink staff because they answered the phone, or our success was actual communication with that individual. So 718 individuals were contacted. 102 scheduled appointments with PA CareerLink staff, and out of the 718 that were contacted by PA CareerLink staff, 214 were referred to a partner program and became program participants. So again, this outreach was very successful. So in addition, one of the UI claimant survey questions asked participants if they would be willing to participate in a focus group. Those respondents that answered yes were categorized by their primary barrier. 2 focus groups for the barriers of transportation, childcare, health, age, background check, GED, training, and caregiver were scheduled during the month of April 2024. The final roster, including 2 additional focus groups targeted for individuals from 17 to 34, included 31 participants. Each focus group was scheduled for 1 hour using Zoom. So the questions on your screen are questions that were posed to each focus group. A common theme across focus groups was the preference for jobs to have flexible schedules. Participants described family responsibilities, including caring for grandchildren, as well as family members with health care concerns as the reason for needing flexible schedules. Participants also shared that remote work was more suitable for them for reasons such as lack of affordable and reliable transportation, family responsibilities, and affordable, available, and quality childcare. Participants noted that the lack of jobs that paid well were a reason for not returning to the workforce. Facilitators also noted that several participants described age and racial discrimination as an ongoing barrier to employment. PA CareerLink opportunities were presented, and participants had mixed responses from not knowing about PA CareerLink to discussing the value of the services and positive experience that they have had. Several participants discussed that their experience at PA CareerLink was not helpful and that the services seemed to focus on job seekers who were at the beginning of their careers and not suited for those job seekers with higher education and experience. So recall, as we had collected the demographics, that many of the participants who responded to the survey had over 11 years of workforce experience. Lastly, respondents had mixed reviews of the PA CareerLink website. Most stated that it was difficult to navigate, and if one lost their access information, they could not use the website services. One participant noted that they would have to go into the PA CareerLink to get re-entered into the system, which defeated the purpose of using the online platform. As part of the project, a focus group was conducted with the L&I project team. This focus group was conducted as a final activity of the work in order to gather their insights on what they had learned, feedback on the process, and suggestions for future work or refinements to serving individuals seeking to return to the workforce. The focus group was conducted online using Teams. Questions centered on what they had learned, how this project could be used to inform future efforts, and what they felt were priorities for systems changes to better serve PA CareerLink clients. The analysis identified 3 broad themes: policy, leveraging the current work for future efforts, and changes to services to better support job seekers. Many issues, such as the need for better transportation, childcare, and better pay, were important findings from the project, which could be lifted up to employers, decision makers, and policymakers who had more influence and control over making change for these broader issues. In their role as support for PA CareerLink operations and job seekers, their role could be of advocacy and ensuring that information was communicated to those who might be able to better inform change. Participants felt strongly that the work conducted in this project should be carried forward to informal local efforts. They highlighted how gathering data and conducting focus groups in their regions had brought forward a more nuanced understanding of the client needs. They noted that to do this, that consistency of reporting data across PA CareerLink needed to be standardized and implemented from the start so that shared information and outcomes would be well documented and able to be shared similarly to inform collaborative efforts. Similarly, they noted that outreach efforts conducted for this project had increased contact local staff had with potential clients. The survey findings, focus groups, and outreach efforts forwarded new issues and ideas on how to better meet the needs of individuals coming into PA CareerLink. Findings from the descriptive statistics, focus groups, and UI claimants and L&I team members and the literature led to the following recommendations. Several recommendations were shared as a result of this project. First, a presentation to share highlights to generate discussions about the impact on local workforce development areas. Next, focus groups with local workforce development board staff to explore the barriers and brainstorm potential strategies to address them. Resources for PA CareerLink were recommended, including an employer barrier infographic with details learned from this initiative and a facilitator guide with talking points. Employer outreach and collaboration efforts could incorporate this infographic and help to highlight needs. Several resources for PA CareerLink staff were recommended, including a job seeker toolkit with strategies to serve job seekers with higher level skills and experience, tools and resources to support special populations, expanding activities and the PA CareerLink image to serve a wider range of job seekers, and outreach and intake scripts for more robust outreach and intake activities. Additional recommendations included a focus group guide for local workforce development boards that provides step-by-step instructions on replicating project focus groups, a standardized data collection tool to uniformly track data on outreach efforts across PA CareerLink centers, enhancements for the L&I team project work, including survey development protocols to support targeted data collection, MOU protocols that can be easily used for data sharing, and a checklist for possible activities and needs to be included when developing a statement of work to support planning and activity inclusion. Finally, recommendations for the PA CareerLink website were suggested, including enhancements based on user experience and website access support that allows job seekers that are already registered for services to gain access to the website if they are locked out or forget their access information. So that concludes the information that was gathered for the UI Claimant Outreach Project. Thank you. Are there any questions?
If you have any questions at this time, please throw them up in the chat. Give everybody a moment to put something forward if they want to. Very good. Gina from Senator Kim Ward's office. I may have missed the fact, but were the results from the survey statewide?
Yes, they were.
And Duncan from Rep Daly's office, Jonas from Rep Daly's office. Are the survey respondents a representative sample of those on unemployment?
And that, I'm not sure if I can speak to that question. We would have to look at another sample of unemployment respondents. This group was specifically from 2020, 2021, and 2022.
All right, we'll give it another minute or so, see if any other questions pop up. Do you know if people who are older are more likely to respond to the survey compared to younger people?
I will definitely for this survey, that is correct. I I don't have an answer about whether or not age has an effect on whether or not you respond to the survey.
All right. And Gina from Senator Kim Ward's office, will this presentation be emailed to us? In other words, will it be available?
Yes, I can send that forward to be distributed.
Okay, great. All right, one last round. Final call. Any other questions, guys? And we can let Crystal and the workforce development folks get back on with their day. And we thank you for their presentation and all the time it took to put this effort together. Thank you.
Thank you.
Yeah, thank you, Crystal. It was a good presentation. We really appreciate it.
Thanks, Josh.
Okay. Barring anything else, then we will make this recording and that presentation available through normal distribution in the next day or two once we have everything squared away. We thank you for your participation today, and we look forward to the next UC Legislative Town Hall in about 2 weeks. So thank you very much for your time, everyone, and have a great afternoon.
Thanks, everyone.